Hi everybody and welcome. Today I'm going to be talking about progesterone. Progesterone is the progestational hormone. That is the hormone that supports pregnancy. And it is mandatory in any pregnancy that if that pregnancy is to survive, then it must have progesterone in order to support the fetus and placenta. If not, women will miscarry without it, as in those women who might rupture an ovarian cyst during their pregnancy, which results in loss of the pregnancy or miscarriage. Progesterone has that name because it's really a hormone that's for women only. While women do need testosterone as part of their hormone milieu into their later years, men do not need progesterone. And in fact, men shouldn't ever take progesterone because of the ill effects that progesterone would cause for men. One, that it is inflammatory to the circulatory system, and two, that it causes men to be asexual, and it is often used in prison in the form of saltpeter as a way of preventing any sexual interest that men may have. So progesterone, it is a great hormone and should be used by women in all stages of their life. Firstly, in women who are pregnant, who may be at risk for having a miscarriage, progesterone is commonly prescribed to them in the form of vaginal suppository, and it is used throughout their pregnancy to prevent pregnancy loss. So that is one time in a woman's life where the addition of progesterone is necessary. In addition to pregnancy, women can often develop a syndrome called polycystic ovary syndrome. This is a syndrome that's present pervasively in our society in up to 20% of women. Those women who are troubled frequently by obesity, irregular menstrual cycles, and have a propensity for pregnancy loss because they don't make progesterone, and also they have a propensity for developing breast and endometrial cancer later in life. And in those women, I often prescribe progesterone, and it's prescribed to them for the duration of their life because it helps prevent them from developing those illnesses, along with adding quality to their life. In addition to women who have polycystic ovary syndrome, women can often develop what's called premenstrual syndrome, which is a problem with painful periods, and emotional aspects of that period may include moodiness, anger, depression, and those women will respond to high doses of progesterone, which I often prescribe to them and use indefinitely in order to treat their PMS, which in some women can be very severe in terms of symptoms. In addition to PMS, progesterone can be used and should be used for symptoms of menopause. And women in their late 40s, early 50s can develop menopause, at which time they'll have the experience of hot flashes and irregular bleeding. Especially in the period of perimenopause, progesterone alone is very useful to give women to protect them from developing symptoms and to decrease or eliminate their abnormal uterine bleeding. In addition to perimenopause, women go on to having menopause, in which case they develop worsening symptoms of menopause, including worsening of hot flashes, night sweats, and all the other long-term effects that come with menopause, including osteoporosis and heart disease. Progesterone is a hormone which has been shown in numerous studies to protect against osteoporosis in combination with estrogen, and to protect against heart disease in combination with estrogen. So it is definitely something that I would prescribe in order to prevent those diseases. Women who are entering menopause are also at risk for the development of endometrial cancer, either endometrial hyperplasia or cancer, and should be prescribed progesterone at that time in their lives in order to prevent that from happening to them. So I hope you can understand that progesterone is a great product. It should be used by all women who are of age to receive it, which is pretty much from menarche onward, depending on their situation and why they might need it. And that it is anti-cancer in its ability to protect against breast and endometrial cancer. So I would recommend it for all the above reasons and for the symptoms of menopause especially. Thanks for listening. Hi everybody and welcome back. Today I'm going to be talking about testosterone and some of the negative things that have been out there regarding testosterone and its use in men and to a smaller degree in women.